on the healthcare reform. And I'd like to recognize the SEIU partners in this event, the Delaware Democratic Party, Organizing for America, Healthcare for America, and Ask Me. So thank you to all the partners who have contributed and are participating here. I'm Lisa Diller. I live in Newark. I'm a Presbyterian minister, and I am, for most of you, your representative on Newcastle County Council. I'm here today because of my connection with healthcare issues, first through the Delaware Ecumenical Council for Children and Families, who has long been involved in health issues, and also at the invitation of Jen Hill. And I just wanted to say that it is, if you are in a congregation, you have people in your congregation without health care. If you are a family member, as I am, of someone who has a small business, they are struggling to find affordable health care for themselves and for their employees. If you have a family member who is out of work, as I've had in the last few months, they are struggling to see if they can afford the COBRA. So for my family, healthcare issues and healthcare reform is incredibly important, and I'm privileged to be here tonight. Here's a little bit of information about our Families USA. It's a national nonprofit that's dedicated to the achievement of high-quality, affordable health care for all Americans. They have had a role of helping folks to understand these issues for over 25 years. They've had a number of roles. They've produced reports about health care. They've acted as a watchdog for consumers over government actions, and they've acted as a resource for state and local groups that are working to improve health care in their states, and that is the role that they come to us tonight. They are our experts this evening on health care reform. Now, during the past few months, we have heard a great deal about Congress and President Obama working to change the healthcare system. And why, you might ask? Well, most of us are already aware that the healthcare system is costly and it doesn't work for everyone. And an estimated 48 million Americans are uninsured, and for many of them, the cost of insurance is prohibitive. Your co-pays have gone up, your out-of-pocket expenses have gone up, and maybe even you are having cutbacks in the benefits you receive from your job. So it's a time that many of us are asking questions about health care, and there are conflicting stories out there as to what is happening. And so we are very, very grateful for Kathleen Stoll, who is the Deputy Director and Director of Health Policy for Families USA, that she is here tonight to help us walk through some of these issues. And with that, I'd like to introduce Paul Baumbach, who is a member of the UUFN. He's a Democratic activist, and he's part of the group that put together this event tonight. Thank you, Paul, for all of your work.
Okay, thank you all for coming. Lisa, thank you very much for being here. This is one of the three political candidates / public officials here today. In addition to Lisa, who's the Newcastle County councilperson, we have State Representative John Kowalko in the back. And also in the back is Scott Spencer, who's running for U.S. Representative. I actually did as little as I could for this event. Really, the person working the most was Richard Field, and he had a very poor judgment to be on vacation this week. But he did an awful lot of front work. Also, a lot of other volunteers from here at the UFN who've helped out today. I've got a partial list: Mike Bridge, Jenna Togo, Pam Green, Jeff Ramberg, Rick McNeil, Gail, and Steve Bush, and I'm sure I've missed a few. Jen Owens also. Thank you all very much for the help you've already done and you continue to do. If you have cell phones or if you have crazy Eileens, please silence them. Have a nice, respectful forum today. And I am, therefore, I think our next speaker will be Peter Sanger. Is that correct on that? Again, thanks for being here.
Hello everybody, I'm Peter Sanger. I'm a small business owner. I'm here to tell you my little story about my little small business. It's so small currently where it's just me and the missus. That's where we're at. But for over 30 years, our little art pottery business has paid the mortgage, the kids' tuition, employee wages, and the health care for workers who wanted the coverage. One of the criteria we used to measure our business was our ability to keep ourselves with health insurance coverage. And it wasn't always easy to do that. Along the way, we had one of our young kids had a serious illness issue, and we had to do the dance with the insurance company who wanted to. So they said, stop selling the kind of policy that we were purchasing in the state of Delaware. They wanted to move out, so they kept raising our premiums up, and we kept paying a ransom because we couldn't afford not to have coverage. Finally, we did the dance over a few years and were able to switch companies and maintain full coverage. It was expensive there for a while. Small business gets credit as the place where jobs are created. I won't be hiring anybody anytime soon, not until health insurance gets fixed. I can't afford it. And we might even be priced out ourselves on the next annual premium increase. Over the past 3 years, our premiums have risen. 2 years ago, they went up 18%. Last year, 23%, and this year, 30%. So we're getting rocked pretty good. In order to afford this year's coverage, we moved our deductible up from $2,000 per person to $3,000 per person. So we kind of wonder if we actually have health care. It's really questionable at those kinds of numbers. You really have to have a major thing before you can seek any kind of service. And that's not uncommon. It feels kind of like a monkey on your back. It feels like you kind of have a drug habit. It feels like this big monster is just looking over your shoulder. And it's a constant worry that everybody in my position has. So as a business person, as a business owner, I ask myself, why is it business's business to deal with this health insurance stuff? Why do we have to waste our time hassling with all this, just all these blockades and all these things that the health insurance industry does? Why can't we spend our time growing our business? That's an easy question. So health insurance is an economic development issue. We can create a lot of jobs. I think a lot of people would start businesses, they change their job, they get out of the job, they're afraid to leave and start something, or they'd hire and expand if they didn't have to do this insanity with health insurance. It's just too insecure. I don't know, you guys know this. So let's take my proposal is to take the health insurance out of the employer's basket and just let's have one efficient system. Personally, I'm a registered independent. I am weary of the politics of healthcare. I have no respect for either party when their agenda and their ideology comes ahead of what is best for the country. I think the best political move would be to do what's best for the country, even if it hurts some of your little constituencies. I only want healthcare to do two things. I want it to be moral, and I want it to be efficient. A moral system covers everybody. Everybody is required to participate. That's what I think the deal should be. An efficient system, obviously, is one that has, a basic coverage that minimizes costs and maximizes services. Economies of scale, applications of information technology. So I can just concentrate. My doctor and I can concentrate on the medical stuff, and we can just forget about all the other business things. So in my business, I compete for my customers' dollars like every other business person does. And I would like to see the private insurance industry compete with a public option and let the best healthcare system in the world come to be.